Of this new wave of summer, it is constantly said that will bring many cases but few hospitalized, and it's true. Now, we speak in comparison with other waves, that is, we refer to relative numbers. It is true that there will be far fewer hospitalized in proportion to the positives detected than there were in March 2020, in October or in January 2021, and, of course, there will be even fewer deaths. But that does not mean that we should settle for figures that seem to be higher than we imagined just 2 or 3 weeks ago. The speed at which the virus is spreading causes the number of cases has shot up in 10 days by 114.74%, which is a milestone since we passed the first wave, when the cases could hardly be counted. This last weekend, 32,607 positives have been detected, compared to 10,179 last weekend, that is, 3 times more. The incidence in 14 days rises from 152.82 on Friday to 204.16 today. In the 12 to 29 age group, it already exceeds 600 cases per 100,000 inhabitants. We are already talking about very high figures and very difficult to manage by the primary care services. Apart from young people and, in general, those not vaccinated with a complete schedule, less and less in Spain, but still 26 million, according to the latest health report, the virus is going to irremediably spread through a part of the vaccinated population. A tiny percentage, in agreement, much lower than that of other waves, but that is worth taking into account and that requires the greatest caution. In fact, we are already seeing a rise in the total number of hospitalized that, all right, is not going to mean a collapse of hospital care, but it greatly increases the individual risk of ending up in an ICU bed or hospitalization. The overall numbers do not seem too worrying, as the total number of hospitalized throughout Spain has gone from 2,495 to 2,723 in 7 days, an increase of just 9.13%. Now, if we go into detail, we see really worrying situations. It is logical that contagions multiply where social interactions are greater and more uncontrolled. From Monday to Monday, the incidents have doubled or almost doubled in Asturias, Cantabria, the Valencian Community, Extremadura and Navarra. In the Balearic Islands, Catalonia and Castilla y León, they have directly tripled. The problem is that also in several of these communities we see a significant increase in hospitalizations.